Hello and welcome. How are you feeling today? Okay, I can see that. Yeah, there's a little something going on there, huh? I'm sorry to hear that, and I think that we will check that out for you and get you all fixed up, okay? Okay, so my name is Dr. Calliope, and I'm going to be taking care of you today. Would you mind if I just ask you a few questions? Excellent. So, let's see here. Would you mind just giving me your name and date of birth, please? Okay, wonderful. And what is your preferred name and how would you like to be addressed? Okay. Excellent. Thank you. So, I can see there's certainly something going on here, right? So, is this the reason for your visit then? Okay. Wonderful. Well, not wonderful for you, but swollen eyes. Okay. So, besides the swelling in your eyes, is there any other symptoms that you are having? Any pain? Any other concurrent illnesses? Okay. Alright, let me start writing that down. The sniffling and the sneezing. Okay. Coughing. Alright. An itchy throat. Okay. And your eyes are also pretty watery. Okay. Alright. Have you had any fever or trouble breathing or anything more severe? Anything of concern? No. Okay. Just really a touch of fatigue. Sure. That makes sense. Okay. Alright, and have there been any changes to the medical history that we have on file here? Okay, wonderful. And what about your family history? All good there? Good. And your allergies, any changes to those? Okay, and medications. Alright, wonderful. And have you tried anything to help alleviate your symptoms? Have you done any cold compresses or any medicines or anything to try to relieve any of the swelling or any of your other symptoms? Okay, just a spot of acetaminophen. Okay, and did that help at all? Not really? Okay. Alright, wonderful. So I think that I am going to pop on some gloves and we will take a look at you. So for our examination today, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, wonderful. Just gonna pop on the other glove here. They're always a little persnickety on a humid day. There we are. All good to go. Okay. So I'm gonna get pretty close to you, okay? And I'm just going to firstly inspect around your eyes, okay? Alright, so I'm gonna get real close here, and I just want to look at how look a touch red as well. That's to be expected. Okay. Now I'm just gonna do a little bit of palpation. Please let me know if there's any pain or discomfort. Okay, so a little painful, more annoying. Okay. Alright, I'm going to try to open your eyes a little wider, okay? Just like that. Okay, it's a little painful. Okay. Yeah, they're swollen quite well here. So, have you gotten anything in your eyes, or did you perhaps work, or were you in an environment that had a lot of dust or any irritants? No? Okay. Have you changed any routines? Have you used any new face wash, hair wash, anything like that? No, everything's the same. Okay. Well, I'm thinking that you have a very bad case of seasonal allergies. And I think we have a couple of things that can fix you right up. But I do just want to look at a couple other things just to be on the safe side, okay? So first I want to just use my little magnifying glass here to just double check that your eyes are just swollen due to allergies and there's not any signs of any other irritants or infection. Okay. So far it's looking like that looks pretty normal. I'm not seeing any sign of any infection. So I want to take a little look at the inside of your nose. So I'm going to grab a speculum and pop that on my otoscope. Doing okay so far? Okay. So I'm just going to just snap that on. Turn that on. Can I have you just tip your head back for me? Wonderful. Okay. I see. So your nasal passages certainly look irritated. And there's a lot of mucus production, which would be pretty in line for either something generally irritating or seasonal allergies. Okay. I'm going to take that stethoscope speculum off, and we'll get a fresh one to look at your ears. Have you noticed any sinus pressure as well? Either sinus tenderness or pain? Or if you've gone to bend over, does it really hurt in this area or your forehead? Okay, it does. Alright. So I'm just putting on a new speculum here, and then I'm going to go ahead and just take a look at the inside of your ears, okay? Okay, so I'm just going to start with this ear over here. And just putting the otoscope in here. And then just having a little look around. The ears actually look pretty good. I'm not seeing any redness or irritation. I'm not seeing I'm going to look at the other ear. Just going to insert the otoscope in the ear canal here. And then, let's see. Yeah, it's a lot of the same story over here. I don't think there's anything going on with your ears. I think that overall they are pretty healthy. Okay. So I'm going to go ahead and take that off there. Alrighty, so we'll put that back. And I just want to have a little look in the back of your throat, okay? Can you open your mouth for me? Alright, and say ah. Okay, yes, definitely very red. I can see that would be pretty irritating. Okay, you can go ahead and close your mouth. Alright, so I'm going to take a few notes here. But I am thinking that you, my friend, have some pretty bad seasonal allergies, okay? Okay. Very good. So there are a few different things I can do for you. So firstly, I'm going to write you a prescription for an antihistamine, which helps reduce the histamine production. Obviously, it's in the name, but that keeps your body from reacting so much. It'll really help reduce the swelling, and it should help with the itchiness in your throat. It should help with the mucus production, okay? So let's go ahead and write you a prescription there. So, and that dosage should be fine, okay? Alright, so that's all signed off on. And we'll get that ordered in for you. And I believe, yeah, they already asked about your preferred pharmacy, so that's all taken care of. And I can give you a few instructions as far as home remedies, and then we can do just a little treatment here today as well, if you'd like. Okay? Alright, so firstly, tons and tons of rest. Okay? And you also want to drink plenty of water. And also cool compresses on your eyes should help quite a bit. And gargling salt water, warm salt water, hot salt water should also help with the throat as well. And a tablespoon of honey could also help soothe your throat as well. So I'm just writing that down there. And also throat lozenges or cough drops, those also can have a pretty good effect as well. If you get the mentholy ones, those might help your nose as well. So there's a few things, and also if you have your windows open at night or even in the day, that may also aggravate your allergies more as you're getting pollen and dust and dirt and everything from the outside coming through your house, okay? So you may want to think about shutting the windows and turning on the AC or whatever you'd like, okay? Alright. So everything is in flower right now. So seasonal allergies are going to be pretty rough for a while, okay? I know there is a big maple outside of my house in my front yard, and it's in flower, and the allergies after that it was the allergy reckoning. It was pretty bad. I lost my voice for a long time. Yeah. So as far as your treatment here today, I actually have a sample pack of the antihistamine that I prescribed you that I can give you today. So I'm just going to pop that out of the foil packet. Okay, there we go. So here it's for you, okay? And there should be there is a new bottle of water just on the counter there. If you'd like to take a drink and have that. And the other thing we can do is we can put a cold compress over your eyes, okay? So I've got some paper towels. And I'm just going to wrap our cold pack in our paper towels. Okay. It's very flexible. It's very cold. We're gonna wrap that up. And then we're just going to place that on your eye, okay? Alright, so I'm just going to just very gently just place that over the eyes there. How does that feel? Okay, so we're just going to hold this for a couple minutes, and that should reduce some of that swelling long enough that we give that allergy medicine a little chance to work, okay? I'm just going to use my hand to place that there. So, it's not too cold, is it? Okay, just fine. That's good. Let me know if at any point it does get too cold. A little on the heavy side. That feels refreshing. That's good. I'm glad to hear it. So, is there anything else that you need to do today? Or okay, you just came in here to get checked out. That's good. You can go back home and you can go back and rest up. Catch up on some daytime television or video games or streaming or whatever it is you like to do. Reading. I like reading a lot on my sick days personally. So this would be a good time to catch up on all those little bits that you miss in your day-to-day life. It's a good time to just hang out for a while. I think we'll leave it on for just a minute more, and then you should be all good to go. Is that area numbed up at all? A little bit? Yeah. Okay. Yeah. I know. I don't like ice packs for that reason of it. It almost feels a little painful as much as it is relieving. Yeah. Yeah, it's not fun. But it is very, very effective, interestingly enough. It's funny how cold and heat can be used as extremely effective treatments in a lot of different things. The body is interesting that way, huh? Yeah. Okay, well, I think that we are going to just pull that off. Okay. Oh yeah, that looks a lot better there. I can see your eyes a little bit more. Well, that's good. That should help you at least until that allergy medicine kicks in, which should be within the next 20 to 25 minutes. Usually that starts metabolizing in 30 minutes once it hits your stomach. So, is there anything else I can do for you at all? Okay, so I went ahead and wrote you all these little instructions here, all the aftercare. Is there any questions you have about these? No? Okay, very good. So I'm gonna go ahead and sign off then. And we will let you get back to it, okay? I really hope that you feel a lot better soon. I know it's not fun at all. Okay. Thank you so much for coming into my office today and letting me take care of you. I hope you have a whale of a day and a good rest of your night. Thank you.